When doctors give patients advice and directions, the patients may not always understand them. A couple of disturbing new studies looked at patient literacy, the ability to understand written questionnaires many people fill out before visiting the doctor. Researchers at Emory University used a simple 7-question form pertaining to prostate symptoms and found that only 1 in 6 patients understood all 7 questions. Simple queries involving numbers were the most troublesome. Joining us now to talk about patient literacy are Dr. Stan Wasman and Dr. Sheila Foreman. We got them both in the studio at the same time. Great to have you, members of our Medical Advisory Board. Thanks for joining us today.
Of course.
Dr. Stan, I want to ask you first, why is it so hard for doctors and patients to talk to each other? And can you give me an example of that?
Well, miscommunication is really rampant in doctors' offices and in hospitals. A lot of it has to do with the failure of doctors to use simple language and a failure to zip their mouths and listen. A brief vignette: I saw a teenager who's complaining of urinary discomfort. So I asked him, "Are you sexually active?" And he says, "Yeah, well, just in the initial stages." And then I'm trying to elicit more information from him. I ask, "Are you experiencing any discharge?" He says, "Well, what's that?" And I said, "Well, are you having any stains in your underwear?" And he says, "In front or in back?"
Okay. So that's obviously the example of patients and doctors not able to talk to each other. So why is this so difficult? What's going on with the patient that he can't even answer a simple
sorry,
question?
I'm so distracted by that last
Yeah, that was a good story.
You've heard of the white coat syndrome. Patients come into doctors' offices, they have heightened anxiety. And so one explanation for why they're not answering the questionnaires correctly is because they're frightened and they're not reading the questions correctly.
Why do we have it then? Why are we filling out this questionnaire in the first place? What is it supposed to do?
Its purpose is to give the doctor enough information to start the initial examination, someplace to start from. Would you agree?
Yes.
But the patients aren't able to come in and say, "Look, I don't even have enough wherewithal right now to fill this out. I'm too nervous." Are they not able to convey the nervousness to the doctor? Do they not even trust the doctor enough, maybe?
Well, I think a lot of patients are able to fill out these forms and to organize their thinking, and overcome the anxiety. I think, as I say, a lot of it has to do with the doctor's ability to use simple, clear lay language and to be a good listener.
There's also an issue of math and with numbers that seems to cause a lot of anxiety. What's going on with that?
For a lot of people, there's a general math phobia. They get scared of numbers. They see numbers on a piece of paper, their anxiety raises, and then they can't answer the question.
What are some of the numbers that they have to deal with?
Well, in these kinds of questionnaires, it might be something as simple as how many hours a night do you sleep, or what is the dosage of the medication you're taking. But just seeing numbers sometimes activates anxiety in people.
Okay, well, it seems to me the questionnaire may be at fault, but is that what's really going on? Is it the doctor issue, the patient issue, or do we just throw out the questionnaire and try something else?
The questionnaire is more a jumping off point. What really matters is the communication that takes place between the nurses, the doctors, and the patient.
How can that be improved? Obviously, this is the issue. Doctors need to, you said, listen more. Can they also instill a little bit more confidence in the patient to be able to communicate to them more?
I think so, by using simple, clear lay language and having the patient repeat back, what they're hearing to make sure they understand things clearly.
When you think health, think IRU.